Welcome. Welcome, my dear friends. Welcome. Myself is Professor Dr. Deshpande. I would like to welcome you all in this particular video. Today, we will immediately start by sharing my screen. So today's topic is regarding the Swasthavrutta subject. Are you getting my point? Swasthavrutta. This is the subject at the moment in 2020 for the third year BAMS course, Bachelor of Ayurvedic Medicine and Surgery. So in this topic, in this year, we have this one of the subject as a Swasthavrutta. What is meant by Swastha? Swastha is a healthy person and Vrutta is an information. So all detailed information, how we can keep oneself, ourself fit is mentioned, is explained in this particular subject, Swastha and Vrutta. Swastha means healthy and Vrutta means knowledge or information. So this is very parallel to the PSM, Preventive Social Medicine subject in the MBBS course. Personally, I like this subject very much because this is very useful not only at the national level but international level. Try to understand my feeling. Okay, but before that, let me make the screen big. So Swasthavrutta paper 1 question papers I have already uploaded. Myself is Professor Dr. Raghuveera Deshpande. Just make the screen bigger. Okay, this is very fine. I am MD in Ayurvedic medicine, that is Kaya Chikitsa subject, and MD in Ayurvedic physiology, that is Kriya Sharira subject. This is my personal website, ayurvedicfriend.com. This is my WhatsApp number 922-6810-630. And this is my mail ID, professordeshpande@gmail.com. You can all contact me for online consultation regarding any disease, typical Ayurvedic management, online consultation. Then many students can contact me for online difficult topic lectures. I have the team of doctors, I have the team of teachers, and I have worked with all this, my team. And also, you are welcome to give any feedback, suggestions, your name, who you are. Are you a doctor? Are you a student? Are you a teacher? Or you are a common man? Because all these my videos are very helpful for the medical students, not only Ayurvedic. My fan circle, fan circle is very big. There are the people from Ayurveda, allopathy, homeopathy, naturopathy, physiotherapy, and pharmacy as well. So all the people take advantage of Professor Deshpande's YouTube channel. My channel name is Rajendra Space Deshpande. Don't get confused. And there you will find a big playlist. Nearly 20 groups are there in the playlist, starting from anatomy, physiology, pathology, herbology, Rasashastra Vaishajya Kalpana, Kaya Chikitsa Panchakarma, then Shalya, Shalakya, Balarog, and Trirog. On each and every subject, I have made videos. Audios are there, videos are there. Some are in Marathi, some are in English, some are in Hindi. I respect each language of this nation, India. Okay, so let us move ahead. My appeal to the CCIM and MUHS, all the universities, that actually giving the question bank to the students is a duty of any higher authorities like CCIM, Ayush, or any university. But as there are lacking of this particular part, Professor Deshpande is uploading by his own personal efforts. He is uploading the question paper. He is uploading the syllabus. My particular appeal to all these people of Ayush and CCIM and NUHS, please upload question papers, previous question papers on your website. Okay. Now, what is this in PPT? There are question papers from the year 2016, 15, 17, and 18, summer and winter, summer and winter, summer and winter, and in 2018, only summer. So this is from MUHS. Now, Let me tell you, many students ask me, sir, how to study? I am getting difficulty. I am getting difficulty in understanding, in appearing for examination. My simple advice, in the beginning of the year, you must understand ATP, Advanced Teaching Program. ATP should be given by each and every teacher of any subject, because this is like a syllabus, is like a driver. I should know which are the things that I should remember to go through this examination of first year, second year, third year, or fourth year BMS. I should know my target, and that target is explained in the syllabus. Okay, then syllabus is like a driver of the car, and I personally name the question papers as conductor. Conductor means who is the person makes the bell to stop at different locations. And that locations we can understand by the question papers. For example, I am studying the whole syllabus. I should understand where I should stop, look carefully, make a concentration, mug up by heart, and then both syllabus and question paper is a very nice combination for the success in the examination. Okay. Now, about the Swasthavrutta subject, I personally feel that Swasthavrutta subject must also include Prakriti determination or advice based on Prakriti. There should be typical portion in the Swasthavrutta subject, advice based on Dhatu Sarata. Dhatu Sarata, what is that Dhatu Sarata? Dhatu means tissues and Sarata means quality. So to determine the quality of rasa, rakta, mams, med, asti, majja, shukra, Sarata is very, very important. So lifestyle according to the Prakriti and understanding the Dhatu Sarata, whether it is the best, moderate or weak. Best means Uttama Dhatu Sarata, moderate, Madhyama Dhatu Sarata, and Hina Sarata, weak quality tissue. So what will happen? If I improve, I can improve my Madhyama Sarata or Hina Sarata to the Uttama Sarata, my immunity will be the best. Now this is the 2019 December up to this month, October 2020, whole world is suffering from Corona pandemic. And everywhere there is a discussion on the mail, on the Twitter, on the WhatsApp about what? About immunity, boosting of immunity, building up of immunity. And then our great Ayurveda department has also suggested few things. But there I will suggest there are some errors. And what are those errors? Chyavanprash is a universal tonic, I accept. So everybody can consume the Chyavanprash 2 big teaspoon early in the morning, Rasayana Kal. But regarding the Ayush Kadha tablet or Ayush Kadha, there are some very hot spices like cinnamon, clove, black pepper. These particular cinnamon, black pepper and clove can irritate our blood, can irritate gastric mucosa, and that's why some people having pitta dominance, prakriti, they are suffering from either acidity, boils on the body, folliculitis, skin infection like symptoms, nausea, vomiting, weakness. Why? Because that spices should be taken only and only with kapha dominant prakriti, kapha dominant conditions, not for all. This is my personal Dr. Deshpande's comment confidentially. For all, I should prescribe some medicines which are universal irrespective of your prakriti or irrespective of your dhatu sarata. And I will suggest Chyavanprash is number one, and only tablet Guruchi Ghanavati, 2 tablets, 2 times in a day for everybody. That I can understand. That I can understand. But cinnamon, clove, every day, high concentrated decoction, quath, kada, I personally will not recommend. That should be taken after Vaidya's advice only. Whether I have a lot of cough with yellow, green expectoration, my prakriti is kapha predominant, I am obese, dyslipidemia, okay, but not for all. Okay. Now, Swasthavrutta subject in India, there is not much now trend. Now, Ayush has compared, CCM has compared that in each Ayurvedic hospital with relation to the education, they should have Swasthya Rakshaka OPD. Swasthya Rakshaka OPD. What is all going on there? Has anybody has made a survey? I personally feel in the Swasthya Rakshak OPD, there should be counseling only based on Prakriti and Dhatu Sarda. Yes, confidently I am telling you. You give me the feedback from your colleges. What is going on in your Swasthya Rakshak OPD? Many OPDs, they are not doing Prakriti Pariksha, Dhatu Sarada, not doing that, but that is wrong. You must do the advice based on Prakriti and Rasayana based on Dhatu Sarada. That is really Swasthya Rakshak. Then also yoga and all naturopathy and all these things, home remedies, Pathya, okay. But you should not tackle any diseases. That is responsibility of the Kai Chikitsa department. I personally worked in the foreign countries from 1994 to 2014. Kindly note, I visited America, Switzerland, Germany, Italy, and Spain. And there I have made a seminars and lifestyle counseling based on the subject of Swasthavrutta. Winter 2016, SAQ of 3 marks and SAQ of 5 marks. 1-page answer is expected. And for 15 marks, LAQ, long answer question, 3 full-scape pages answer with figure is expected. Right? Aniyat atank praya hetu in Janapada Dhvamsa. Can you see the beauty of this topic? Janapada Udvamsa. Janapada Udvamsa. Jana means public, Pada means locality, and Udvamsa means destruction of the health. So Jana Pada Dhvamsa is very similar to the epidemic and pandemic. Epidemic, endemic, and pandemic situation is mentioned by Charak in the topic Jana Pada Dhvamsaka Vyadhi. Mention 6 signs found in the first stage of measles. Next, noise pollution. This is very common nowadays. And I salute to people who are contributing fire less or cracking less Diwali. That is very good. Because atom bomb, boom, so much sound pollution. There are people in the houses, very old people, senior citizens, having some paralysis or problem with the ear. They get frustrated with this noise. Now, noise was not only in Diwali, there are other festivals also. I am not against of any festival. I am against for the air pollution. I am against for noise pollution. Even the traffic, you can see too much noise. The police people, they get problem with the ear. Tinnitus. Then loss of hearing capacity can occur because of the noise pollution. DJ. Bolwata, DJ la. Loud in processions. I am not against any religion. I am not bothering about religion. I am talking about air pollution and noise pollution, which is not only for ear. Not only for ear. Ear is Akash Mahabhuta Pradhan. Akash. Lumen is there. Srota, hollow. So wherever in the body there is Akash predominant organs, they will be get damaged because of noise pollution. Very fantastic and different aspect by Professor Deshpande. Professor Deshpande's videos are not only of 5 or 10 minutes for fun. No, we are educating ourselves. We are training ourselves. Try to understand this feeling. So understand the concept. So ear is Akash Mahabhuta Pradhan, predominant, space predominant, hollow space predominant, and that's why that noise pollution, sound pollution can affect not only to the ear but any hollow parts, arterial lumens, gastric region, intestinal region. He will suffer from the problems of digestion. Remember my words, because of the noise pollution. Very, very funny things, but it is happening like he will suffer from hypertension. I know that. He will suffer from tinnitus. So kindly look for that matter. What is quarantine? Actually, this question was asked in the paper of 2016 when there was no corona. When there was no corona. Now we have COVID-19, corona pandemic, but now everybody knows what is quarantine, separation of the patient. Okay, contact person. Right objectives of the school health service. I have done many school and college students health checkup, but I am very sad to say there is not very sharpness in that examination. It is not a fault of any person as such, any community as such, any school as such, any college as such. This is the fault of the system. They do this health checkup as a formality just to complete after admission within a period of 2 months, 3 months. This should not happen. Careful examination should be done. Especially, I am warning about the 12th standard student or college FY, SY students, especially FY, first year, BA, BCom, BSc. These students, their genitals should be examined during college health checkup. Why? There is one condition which is called as a undescended testis. Undescended testis, that is cryptorchidism. Very difficult word. Cryptorchidism. Testis is in the abdomen. Ideally, they should come into the scrotum at the time of birth, but they are not coming. And doctor should examine first year BA, BCom, BSc students genitals, testis. If they are not, immediately refer to the particular doctor, surgeon, and then he will do sonography, find out, and he can try to bring that testis from the abdomen to the scrotum. This is very essential for normal spermatogenesis. Otherwise, this 19, 20 years young chap will suffer from infertility when he gets married. And then there is no use. If at all you do the operation, there is no use because there is already atrophy of seminiferous tubules. We are discussing the question papers, but it's not only reading of the question paper. Dr. Deshpande is trying to explain some important points of the practice. What is droplet infection? That's why we put the mask in the corona pandemic. When then some drops are coming in the air and front person gets affected with corona. It is not only for corona, it is also for tuberculosis. This is a national health problem. So droplet infection, that tuberculosis patient whose AFB, acid fast bacilli test is positive, who is having open cocks, he should wear the mask. He should not mix in the society. This is not for corona. This is many diseases which are getting droplet infection. That's why we don't send the child who is having measles to the school. Why? This is because of the problem of droplet infection. 5 marks SAQ. Write the methods of disposal of refuse. How we should dispose of the refuses? Write DPT vaccine, diphtheria, pertussis, and tetanus. Diphtheria is little bit less and less in these days, but still pertussis is there, tetanus is very common. So this vaccination is prevention, and prevention is always better than cure. Right? Rehydration therapy. ORS, oral rehydration solution. You can get a ready-made electral powder. in the medical shops, or you can prepare of your own. 1 liter of water, then 1 spoon or rather 1 full lemon juice, then big 4 spoon of sugar and 1 big spoon of salt. That is called as a oral rehydration. And that particular sharbat, medicated water, should be given to the patients of diarrhea, loose motions, gastroenteritis. For hydration is most important. Otherwise, the person will suffer from hypovolumic shock, unconscious hypovolumic shock. Okay, typhoid is one of the important disease. Still, it is there with the contaminated food and especially water. What is Ayurvedic concept of immunity? Ayurveda has explained Vyadhi Kshamatva. I will tell you one line. What is Vyadhi Kshamatva? Vyadhi Kshamatvam Nama Vyadhi Balavirodhitvam Vyadhyutpada Pratibandhakatvam iti. Two things are there. Vyadhi Kshamatvam Nama Vyadhi Bala Virodhitva. If you have already the disease, we have to reduce the strength of the disease. Corona pandemic, you have become a positive. It is already existing now. We have to reduce the antibody titer. We have to control the infection. That is Vyadhi Balavirodhitva. And Vyadhyutpada Pratibandhakatva. We are at the moment no corona, no COVID, but we want to protect. Then sterilization, mask, social distancing. This is Vyadhyutpada. Utpadana means creation of the disease. And we want to prevent the creation of the disease. One, disease is existing and we want to reduce its exacerbation, intensity, duration. That is Vyadhi Bala Virodhitva. This Vyadhi Kshamatva is depend on Trayopastambha, Ahara, Nidra and Brahmacharya. Trayopastambha, Ahara, all about diet, about food, freshly cooked, sattvic diet, no rajas, no tamasic, no fast food. Sat, Ahar, Nidra. Nidra is not only sleep. Balance in between the activity and sleep. And all about the activity. So there are different aspects of the immunity according to Ayurveda. We have to follow Dinacharya, daily regimen. Rutucharya, seasonal regimen. We have to improve our Dhatu Sarata. We have to make a lifestyle based or match with our Prakriti. This is all aspects of Ayurvedic immunity. But that can be the very big lecture. Okay. Right benefits and adverse effects of OCP, oral contraceptive pills. Okay, they are very good for family planning, but there are some side effects of hormonal treatment. You must be careful about that. Right about rapid sand filter, purification of water. Now LAQ, right, antenatal and postnatal care and describe of maternal mortality. If you don't proper care of the pregnant lady, like what we nowadays very famous, that Garbha Sanskar Vidhi. So there are different, you have to check the blood pressure all the time. You have to take the hemoglobin, you have to check the urine albumin, pre-eclampsia, eclampsia. So all these things. Then puerperial, after delivery also, there are what you can say the Balanta Kadha number 1, Balanta Kadha number 2, Balanta Kadha number 3. These are the specific 3 decoctions prescribed by the Ayurveda in the puerperial period, after pregnancy, after delivery, which are the water-borne diseases. Simple are cholera, typhoid, jaundice, etc. Describe revised National Tuberculosis Control Program. Write in detail about health administration in central level, state level and district level. Don't worry. Blank side means next year, summer 2016. Write types of vaccine and describe DPT vaccine. Mention the methods of disposal of dead body. You know how serious is the matter in the corona? Space becomes less, but the best way is burning. Burning makes the dead body disposal very scientific. Describe the composition of WHO recommended ORS, oral rehydration solution. Define primary health care and write its principles. Mention methods of refuse disposal. Write the signs and symptoms, stages of measles. My dear friends, in my YouTube channel, if you open the Kai Chikitsa subject, 100% you will get this very nice video about measles. Please see that particular videos. Next, describe Alma Ata declaration. Alma Ata declaration. Mention the Ayurvedic concept of infectious diseases. Write the names of water-borne diseases. Simple is the jaundice. Write about the foundation and functions of UNICEF, worldwide organization. Write in detail about household water purification methods. Simple is, of course, the boiling. Boiling for 20 minutes is the best method. Describe district health administration and Panchayat Raj system. Write composition of air. Mention the causes of air pollution and methods of prevention of air pollution as per World Health Organization, WHO. Mention the causative agents of malaria, falciparum. Falciparum, different species are there. Fever with rigor, this is the most important. And risochin or the chloroquine and the primaquine are the best medicines. Its incubation period, signs and symptoms of malaria. LAQ. Mention the names of national health programs and describe the revised National Tuberculosis Control Program. You must know about DOT treatment, directly observed treatment, DOT. You know the medicines, INH, rifampicin, pyrazinamide, ethambutol, everything. Then AFB positive, AFB negative. Mention the objectives of maternal child health care. Describe MCH program conducted in India. Mother Child Health Care Program. Define health statistics. Write about the source, uses, collection methods of health statistics, birth rate, death rate, mortality rate, etc. Mention the current death and birth rate in India. Write the objectives of family planning. There are different methods. Condom, then best is OC pills. These are the two important. Then vasectomy, tubectomy are permanent methods. Describe the hormonal and intrauterine devices like copper T for family planning. Don't worry, next year, winter 2015, SAQ 3 marks notification, intimation of any communicable diseases to the government, corporation. Then catadine filter, a typical type of filter for water purification. Write about the concept of Sankramak Rog. This is the Sanskrit word mentioned in the Charak. Sankramak Rog means communicable diseases. That is already mentioned in Ayurveda. Waterborne diseases, Gobi by UNICEF. What is Gobi? Here I have explained Gobi. G for growth monitoring of young children, height and weight chart, growth monitoring. O for oral rehydration therapy for loose motion and vomiting. B for promotion of breastfeeding. Matureva pibet stanyam. The best food for newborn child is breast milk. Immunization. So Gobi, growth monitoring, oral rehydration, breastfeeding, and immunization. Describe airborne diseases. SAQ, housing and health. Copper T, definition and types of disinfectants for cockroaches, ants, ticks, methods of removal of hardness of the water. Winter 2015, gonorrhea, one of the very common STD, sexually transmitted diseases. Most important is HIV, AIDS, but syphilis is there, gonorrhea is there, LGV is there, lymphogranuloma venereum. Gonorrhea, most important is pus and burning of urethra. Sticky pus is there and burning is there. And so gonorrhea cannot be hid by the patient. He always, he will not speak directly. He will say, doctor, I am having the burning of micturition, a very severe burning. Doctor, please give me some injection. Then immediately you can ask him whether there is any discharge from the urinary part, yellow color, show me your penis, and you will definitely find that sticky pus is coming. And you can directly then ask whether you have visited to any prostitute, whether you have gone to that red alert area, whether you have met with your girlfriend. So this is because of the unsafe, what you can say, the coitus or sexual act. So everybody must wear the condom, and of course extramarital affairs should be avoided. That is very clear. Then alma ata declaration and antenatal care, especially blood pressure, urine albumin, and fetal heart sounds, etc. Winter 2016 LAQ malaria causes, symptoms, diagnosis, treatment, along with the preventive measures in detail. I have already video uploaded on the malaria. Please check it on Kaya Chikitsa subject in the playlist. Write the structure and functions of primary health center PHC in detail. Describe rapid sand filtration in detail and write the difference between sand filter and rapid sand filter. Describe biomedical waste management. Nowadays, this is very, very common. Now, everything is being standardized all over the world, in the India as well. Standardization for educational system. There is an institute, NAC, NAAC, National Accreditation and Assessment of Higher Educational Institutes, NAC committee. This is the committee. NABH. So this NABH always check whether the people know about the red bag, yellow bag, white bag, etc. and where I should put the cotton, where I should put the needles, where I should put the glasses, where I should put the dry waste. So all this biomedical waste management, every doctor should be aware of. Even the corporation has made a very stringent laws regarding this. Don't worry, blank slide means next year. Summer 2015 SAQ, rapid sand filter. Causes of Janapada Udhavams in Ayurveda. Ayurveda has said the word adharma. Here, dharma is not regarding the religion, Hindu, Muslim, Sikh, Christian. No. Adharma means you are not following the right code of conduct. Right code of conduct. How you should respect to the nature. Deforestation is adharma. Cheating the people, adharma. Ethical code of conduct, that is called as the dharma. Causes of Janapada Dhamsa is the basic cause. Definition and importance of notification. Vayu Shuddhi Prakara, as per Ayurveda, Dhuma. You know, Dhup Prajwalan. So in this, fumigation is very important, not for only operation theatres, but for overall in the areas of where we have done the patient isolation, quarantine in corona, you do the dhupana in Ayurveda. That is Vayu Shuddhi Prakara. BCG vaccination to prevent the tuberculosis, and Bhumi Shodhana. Disadvantage of hard water. Modern treatment of malaria with chloroquine, that is Risocin and Primaquine. Hazards of radiation, like even the cancer. Types of leprosy, that is lepromatous leprosy and tuberculoid leprosy and its symptoms. Advantages and disadvantages of OCP, oral contraceptive pill, naming Mala D and Mala N are available in the market. Different lab investigations for HIV or the AIDS. World Health Assembly. Describe RNTCP. I have given the full form. Revised National Tuberculosis Control Program, RNTCP. Describe the different types of waterborne diseases like jaundice, cholera, typhoid, gastro, etc. Causative agents, symptoms of cholera, Visuchika in Ayurveda, and information about ORS, oral rehydration solution powder. Describe the terminal methods of contraceptive procedures. Describe the relation between traffic and air pollution, problems with the police, and explain the preventive and controlling the procedures as per the different occupations. Next year, summer 2017, right composition of air. Incubation period. That means attack of virus bacteria is there, but till the symptoms appear, there is in between the gap, that is called as incubation period. Okay. Right methods of solid waste disposal. Summer 2017 SAQ, soil pollution, symptoms of tuberculosis. The most important for lung tuberculosis is evening rise of temperature, cough, anorexia, and weight loss. Don't forget these symptoms. Evening rise of mild temperature. So the patient should be asked to take the morning temperature 8 a.m. and 8 p.m. for 1 week, and you will observe there is at least 1 to 1.5 degrees centigrade difference. Morning 98, evening 99. Morning 97, evening 99.5. So this type of difference will be there in morning and evening. Weakness will be there. Weight loss will be there. In last 3-4 months, weight loss will be there. And anorexia, loss of appetite. These are the important tuberculosis symptoms for lung TB. But TB can affect to any part of the body, like for example, tuberculosis of the meninges, tubercular meningitis, tuberculosis of the skin, ileocecal junction in the abdomen. Abdominal tuberculosis is also very common. Okay. Indian Red Cross Society. Difference between active and passive immunity. In active immunity, the person himself try to build the antibodies in the body. So creation of your own antibodies, that is active type of immunization. And when ready-made antibodies are given to your body, that is called as a passive type of immunity. One simple example for the tetanus. TT, tetanus toxoid. That is, we develop ourselves some antibodies, but it will take some time. That's why at least once in a year, or there is some specific schedule how you can make a tetanus immunity for yourself. But when there is a road accident and severe wounds are there, infected wounds are there due to the soil and rusted iron, then we give the ATS, anti-tetanus serum. Only TT will not suffice, will not adequate. There you must give anti-tetanus serum as a passive immunity, ready-made antibodies, because tetanus can be fatal, or tetanus is fatal. Remember this condition. Qualities of ideal contraceptive. Describe PHC, primary health care. Causes and hazards of noise pollution, sound pollution. Right, advantages and disadvantages of electric cremation. Right, modes of disease transmission, how the disease can be transmitted from one person to another. Right, duties of school medical officer. LAQ, describe national blindness health program due to the deficiency of vitamin A. Everybody should consume the carrots and radishes every day. Ghee also. Ghee is very important for vitamin A. Describe in detail cholera with control program. Define Janapada Dhamsa, epidemic, endemic, pandemic, and describe Aniyat Atank Praya Hetu with preventive measures. Mention utility of statistics in health sciences and describe the methods of data presentation by tables and graphs and all these things. Next year, winter 2017, write about the physical causes of industrial hazards. Define immunity. Mention its types, active immunity and passive immunity. Congenital or from the birth immunity you get from your mother. Describe a sanitary well. Write the functions of PHC, primary health center. Define maternal mortality. Write the formula of defining the rate. Mention the current rate in India. Write the causative agents, mode of transmission and incubation period for poliomyelitis, that is polio. This is LMN, lower motor neuron disease. Define this infection and state its types. Describe the levels of disease prevention. Write biomedical waste management. Mention the functions of World Health Organization and write the slogan of WHO for the year 2015. Every year, WHO declares some target and there is a slogan. Then mention the difference between slow sand and rapid sand filter. Mention the causes, signs, and treatment of Janapada Dhwamsa, epidemic, pandemic, endemic. Describe the vector control measures of malaria, Hivata, Thandita. Then describe the causative agent incubation period, mode of transmission, types, cardinal signs, and control program of leprosy. Hypopigmented patch without sensation is a cardinal sign for leprosy. Kushtha, a type of kushtha according to Ayurveda. Kushtha in Ayurveda is all skin diseases. Don't get confused. Okay. Describe the method of best treatment in urban areas. Next, describe national immunization program. Describe in detail about central state health administration. Next year, summer 2018, what is Janapada Dhwamsa? Epidemic, endemic, pandemic. Write down the composition of air. Write down the Ayurvedic methods of water purification. Best method is boiling for 20 minutes. What is safe and wholesome water? Potable water. Write down the types of soil. Write down the hazards of noise or sound pollution. Write down the airborne diseases like corona or this COVID-19. Describe Ayurvedic ways of purification of air, that is fumigation or dhupana in Ayurveda. Describe causes of Janapada Dhwamsa. Write down the duties of school medical officer. Describe the physical method of disinfection. Describe immunity according to Ayurveda. Describe midday meal program of government in detail. Describe in detail the World Health Organization. Describe the causes of population explosion and National Family Welfare Program in detail. Describe in detail the malaria with control program. Describe occupational health, occupational diseases, prevention of occupational diseases, and measures for welfare of workers. Now, this is all about the question papers, and I have enlisted all the important points once again for rapid revision. You must concentrate on Janapada Dhwamsa, noise pollution or sound pollution, quarantine, school health services, droplet infection, disposal of refuse, ORS, oral rehydration solution, immunity, oral contraceptive pills, rapid sand filter, antenatal and postnatal care, waterborne diseases, TB control program, health administration, immunization with DPT and BCG are important vaccines, disposal of dead body, primary health center, measles, malaria and typhoid, these are the important diseases. You must concentrate on that. Alma Ata Declaration, UNICEF, air pollution, MCH program and Catadine filter, Indian Red Cross Society, hardness of water, biomedical waste management, leprosy and night blindness, AIDS. My dear friends, this is all for today. I wish you all the best. I wish you all happy, healthy, and long life. I request all of you, please share all these my videos to your friends, to your teachers, and all fraternity, doctors, students, teachers, and common man. But any of the videos is not recommending self-medication. But my dear friends, you can be the health ambassador and ask your friends to subscribe my YouTube channel. This is my humble request to all of you. Now I am concluding this video and take care. Bye bye. So I am stopping this video. Bye bye. Bye bye.